information, you can throw that information right into that Q&A box. So again, we are so excited to share this information with you today. And we just believe all of this will be of real service to you and your organizations. So right now, I would like to take this time to ask our panel to introduce themselves. Please tell us a little bit about who you are and your background.
Good afternoon, everyone. My name is Shamika Goons. I am in Boston, Massachusetts. I have a degree in public health with a concentration in community health. I have worked in the emergency room for many years, and more recently worked at the Louis D. Brown Peace Institute as a survivor support coordinator, where I dealt with survivors of homicide within the first 48 hours to do a needs assessment and offer practical, emotional, and logistical support and advocacy. I am currently a part of the wonderful HAVI training faculty team.
Thank you, Shamika. Hi, everybody. Good morning and good afternoon, for depending on what coast you're on. My name is Nicky MacCallum, and before I start, I just want to acknowledge my privilege in this space, and let you all know that I always welcome feedback, more culturally humble and responsive. So currently I'm part of a training and consulting group called Allies for Equity. But prior to that, or at the same time as that, for over 13 years, I worked at Youth Alive in Oakland, California, helping to build a frontline community-based counseling program. Eventually, I became the healing director there. And in that role, I supported both the community counseling and the Gaddafi Washington homicide crisis response team, which supports families in Oakland and the surrounding areas. And I recently published a children's book on tough feelings and tools that help.
Hi, everyone. Good afternoon. My name is Laura Vega. I use she, her pronouns, and I'm the co-director for Children's Hospital of Philadelphia's Violence Intervention Program. And for my background, I'm a licensed clinical social worker and a trauma therapist, and spent many years, I think about 13 years, I've been working at CHOP Violence Intervention Program. I started as a frontline violence prevention specialist and became very passionate early on about the issue of secondary traumatic stress and burnout, and developed a model called the Stress Lesson Institute. So I'll be happy to share a little bit more about that later in the presentation today.
Hello, everyone. My name is Johnnie Williams. I am the current executive director of Denver Youth Program, which is a program that houses 7 different initiatives here in Denver, Colorado. We're working with young people from those that are involved in gangs, and we have a hospital-based intervention program. We have a social enterprise. We have an outdoors program for them. We have a educational program for them, and we also support them with tattoo removal and graffiti removal in the community. Those are some of the things that we are currently doing. My background yields from Chicago. I'm born and bred in Chicago, and was able to move to Colorado with some understanding of what community and violence was, and be able to try to get ahead of some of the things here in Colorado. I wear a lot of different hats, and I think that one of the roles outside of my professional role that I like to lift up is that of a father. Right? So I'm so proud of my daughter, who is in this work as well, and she's kind of helped lifting me up, and I'm paving the way for her. So I'm happy to be here with everyone, and we'll talk. We're just gonna welcome you into our offices and our living rooms and just have a conversation. Thank you for being here.
Thank you so much, each one of you, for sharing your background, sharing who you are, so that we can get this conversation started. Like you said, Johnnie, in our in our living room, right? So before we really start getting into a little bit more, I would actually like to take this time to ask you, Nicky, if you would be able to really ground us in the foundation of this webinar and this topic by sharing and talking about this slide right here with us and what that means.
Absolutely. Thank you, Marquita. First of all, I just want to say that the quote on this slide comes from a fantastic book called Trauma Stewardship, which I highly recommend if you're not familiar with it. And this particular quote is really related to the cost of caring. The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. We wanted to use this quote to ground us in our time together today because many of us in the field describe our work as more of a calling than a job. We may have been hurt ourselves and we want to be the kind of provider we wish we had had when we were going through it. So we may set ourselves extremely high expectations for ourselves and our team. You know, lived experience, empathy, and connection to those we serve can absolutely be our greatest asset, but it can also be our greatest challenge at times when it comes to creating that work-life balance. And so the folks on this panel, we all share the belief that it's not a question of if we will be impacted by the work we do, it's more a question of when and how much. And so our hope is that this offering will look at the importance of an individual and organizational commitment to provider wellness during these challenging times.
Thank you so much, Nikki. Thank you for grounding us in just the foundation of this webinar, the impact of this field of the work and why it's just so important. So just thank you so much for that. So we're about to get into everything, and we are going to start off with everyone on this webinar first. All right. So this is going to be a very interactive webinar, especially right now as we're getting started, because like I said, we want to hear from you and want to hear your thoughts. So this is our first thing. When you hear the word mental health, and again, this is to everyone in this webinar right now. When you hear the word mental health, what does that mean to you? So you can use the QR code that is on the screen right now. You can take your phone, you can use the QR code. If you're on your phone, you can also kind of go to www.menti.com and you can use the code that is at the top to go ahead and let us know, what does the word mental health, when you hear it, what does it mean to you?
We are experiencing a little bit of lag time, folks, so please be patient with us.
Wonderful. Hmm.
So many great responses coming in.
Absolutely. Absolutely. I'm seeing therapy as a big one, well-being, emotional well-being.
Stigma, yeah.
Yeah.
I was just about to say that, Johnnie.
Yeah.
Absolutely. Stigma was one that just stood out to me as well.
Evolving too, it is an ongoing journey. That's a great one as well.
Lost, not evil. I love that.
Yeah. Wow. Lack of resources, I see also is one that's on there. Yeah.
I love to see connection on here too, because it's such a critical part of this whole process.
Yeah. I love that. Thank you all so much for sharing your thoughts and sharing some of those words with us. Thank you for your engagement in this activity. I'm going to go ahead and put this down. But again, you can always still shoot some more words out there, you know, put that on in the cloud. It'll still stay with us and we can see that more. But I'm going to go ahead and I'm going to stop sharing my screen because I want to ask the panelists a couple questions. So now I want to hear from you, and I'll ask you, and I'll start with you first, Johnnie. What do we classify as mental health, especially broadening that idea of what it means? What does this look like in the lives of frontline workers and their clients?
That's an important question. Thank you, Marquita. Like, what do we classify as mental health? That's such a important question in the way that you phrased it, because we classify like from our experience and we classify from the things that we've heard. That's why I love to see stigma on there, because the stigma that is around that word, and the part where they were talking about loss and not evil. I mean, the way I classify mental health is like anything else, like when we're going through a situation in our lives or in our world, and things are not the way we expect them to be, where all the different parts of our brain come together to try to make things normalize or make things acceptable or make things, palatable for us. And sometimes, when we're doing those things, it comes out in some behaviors. We call them coping skills, right? So, and depending upon where you're from, how you've grown up, what your experience is, what your resources are, your coping skills might look different, right? And I think like some of us, we self-medicate, and sometimes it's with a substance. It could be smoking marijuana or drinking beer or relaxing in a tub or taking a walk. I mean, we self-medicate some of the things that make us feel better, and we don't recognize it as being mental health. I'll use myself as an example. It's like if the things that are like coming out. So when I start noticing that maybe my staff or myself or my clients are going through mental health, I notice things like the people that we will work with, a lack of energy, or some of the things that were in the Metrometer there is being burnt out and not sleeping well and presenting differently. The conversation is different. And we start saying that these things are not normal, and we're trying to figure out like what is it that we need to do, and we're all guilty of it. Something is off kilter from what we believe or what our experiences are. We're like, that's not right. Something's wrong with that person, or something's wrong with this, right? So in my own personal situation, as I was growing up, I didn't sleep well, right? And I was a night owl, and I worked better when I in the middle of the night. And I think that some people could see that as depression because I'm not sleeping well, I eat differently, and they might identify that as depression. I've done security for many years, so I look around. I'm always alert. I always seek to know like what is around me, who's around me. Some people might call that paranoia, right? I wear a lot of different hats, so I'm in different rooms all the time, and I act differently in these different rooms. So I might be in one room and I'm happy, and then I go to a different room and I'm wearing a different hat, or I'm code switching and I'm not happy. And some people call that bipolar, right? So some of the things that I do in my everyday life and the way I move throughout this world to be sustainable, some people might see them as symptoms of mental health. And I just see them as coping skills. I just see them as things that I do, right? But like anything else, it's duration and frequency. So if I'm doing these things all the time, like I like the things to be neat and in order. And I just thought that I'm a structured person. I like things neat and in order. Some people might call that being OCD, right? And they diagnose, and then it's always perspective. You go to different therapists and they give you different diagnoses because of their background and their history, or what they're bringing to the table, and you may be misdiagnosed. So I just want to caution us when we talk about what mental health structurally looks like, might be just how other people are living their life. And even though all of these things that you guys have put into the Metrometer and all the things that you put into the answers about like, fatigue and stress and fatigue, those are things that are part of most of our lives. And some people can look from the outside in and diagnose us as having mental health issues, right? And I just want to make sure that in this conversation we have today, that even though you have all the answers, that we could put them in a place to where people are lost, but not evil. We don't want to weaponize these terms.
Thank you so much, Johnny. That was so powerful. And I love how you ended with the weaponize and don't want to weaponize these terms. Thank you. Nikki, I'll ask you, what about your thoughts on this?
Wow, thank you, Johnny. That was so powerful. And I really want to echo everything that you said there. That was so heartfelt as well. And I think it's sort of that recognition again of that it's okay not to be okay, at times in this work, right? And that these kind of experiences can be a normal and natural way that we've coped. The idea, hopefully, is that the ways that we cope that help us and work for us and support us. And so we're going to talk a lot more about some of those things later today. But also, so too many of us have been limited to this idea that mental health is about therapy. It's about one idea. It's about one approach. It's about a Western model of care, when we know that it's so much more than that, when we know there are phenomenal Indigenous practices, we know there are fantastic tools, and people wouldn't necessarily, they talk about going to therapy, they don't talk about going to boxing or going to the gym or all of these other things that we can do, talking to a friend, all of these other things that really are an important part of mental health. So I just want to also just ground us in the fact that all of us here have a very much broader idea of mental health, and Johnny put that out there so clearly and so well.
Thank you so much, Nikki. And so
I would think I could jump in here as well. Just wanting, that's okay. Just wanting to add a little bit that I think in the violence prevention work, I think frontline specialists, they see and absorb so much pain, loss, and injustice. And I hear a lot from my staffs. And when I was a violence prevention specialist, often the systems too that we're working within can often re-traumatize our clients and our patients. And so I think just want to also normalize kind of many of the reactions that all of you put in the questionnaire that you received before this, that many of the responses and reactions are really our normal ways our body protects us from some of the abnormal things that we witness and deal with in our work settings. And then I think I just wanted to lift up whoever wrote connection again in the Mentimeter, because I think mental health for me individually really is this ability to stay connected. Sometimes that's staying connected to my body, because we all know that the body keeps score and trauma shows up there first. But also staying connected to my team and my support systems. And I think most importantly in this work is that we stay connected to our passion and the why, like what is driving us, what is motivating us to come back each day. And then I think, that's like on an individual level, but collectively, many of us are impacted by this work, like we talked about. And then it's collectively trying to just create spaces wherever we can to show compassion to others and to care about each other.
Thank you so much, Dr. Vega, as well. And you just hit on a couple of words you said in there, trauma, right? And you said that word, and that's important because I think before we dig deeper into this, I think it's important that we also define trauma, because trauma looks different for everyone and everyone experiences trauma differently. So what is trauma? And so this again, everyone in this webinar, I want to ask you, when you hear the word trauma, what does that mean to you? And I'm going to share my screen again with another Mentimeter for you to participate in. And we want to hear from you again. What does trauma mean to you? So let me get my screen up for you. When you hear the word trauma, what does that mean to you? Mm. Mm. Some of the big words I'm seeing, y'all, are pain and hurt. Are some of the big ones it looks like uh, that are very prevalent when we're putting this in, when we think about that word trauma.
I saw scars of the soul pop up there, and even though it's moving around, my eyes are still tracking it because, woo, man, trauma goes deep.
And on this one, if you can see it, someone has disconnection when it comes to that trauma.
I want to raise up invisible wound as well, because it's not always what people, what people can see. There's so much going on beneath the surface.
I'd love to hear more about brokenness, Lord. It's definitely overwhelming.
Mm-hmm.
Disruption.
I'm drawn to the word healing because I think it's also interesting in the context of trauma, and I think a lot of us, heal through difficult times as well.
I see life lessons, which, we can all learn through trauma. So,
And generations. That's really powerful as well. So I definitely want to lift that up. Very powerful.
Lack of healing. Someone put in the chat judgment.
Ooh. Yeah, definitely see that. Thank you all again so much. I'm going to take this down off of the slide so we could talk a little bit more about trauma. But thank you all so much again for your engagement. And so, and actually I'm gonna go to my next slide on the definition of trauma. So yeah, let me bring my slide right back up right quick, just so I can make sure we have a definition of trauma, right? So as far as a definition of trauma, we see that trauma is a traumatic event or a life experience that involves actual or perceived threats to the safety and well-being of an individual or to someone close to the individual. Trauma is the result of an event or series of events that are experienced by an individual as physically or emotionally harmful or life-threatening, and can have lasting adverse effects on their functioning and well-being. So I'm going to stop my share and I want to ask you a question, panelists. And I really want to be specific with you, Johnnie. What is trauma? We just saw that definition, but I want you to tell us, what is trauma and what does that look like, especially in the front lines and those serving the community? And when does trauma look like resilience?
That's a good question. To be honest, I had to learn how to identify trauma. I didn't know what trauma was. For me, it was my lived experiences. People had to tell me that I was being traumatized when I was just coping, right? And that was something very difficult for me. And but then on the retrospect of it, if I saw other people going through things, that traumatized me. I felt that as trauma. I carried their pain, right? So just a couple of quick examples. I told you guys that I was a part of the hospital-based intervention program. I was one of the first bedside specialists. And one that night I was there and I was being profiled by one of the surgeons that was there in the hospital. And it was no big deal to me, right? But one of my doctors that support our program was there. And she's a white female and she was beside herself. She was like, you can see the trauma in her face. And I guess much like I do with my clients, she was more traumatized about it than me. And she told me in that moment, like, you should feel horrible how he treated you. Why would why would he talk to you like that? Why would he, treat you that way? And I'm used to it because I'm like, I deal with this every day. I became desensitized to the pain. And she, in that moment, helped me to understand that, like, just because I'm used to something, just because I've learned to cope with it, just because I've learned to deal with it, don't mean I should not identify it as trauma. Because like a rubber band, I wish I had one, but if you stretch that rubber band too far, it's going to snap. And what I was not remembering is that the trauma that I have learned to cope with, that I'm stacking on, that I'm hiding, and that I'm, building past, could one day be that break that can send me into the mental health that we was talking about earlier. And then there was another issue that I was dealt with. So I was not identifying my trauma as trauma. I was identifying as other things. So when my daughter passed away and the police were asking me questions as if though I did have something to do with my infant daughter's passing, I was pissed off. I was angry. But then as that situation passed and others was talking to me about it, they told me I was traumatized. So I had to identify that as trauma. When my brother was sentenced to 25 to life, again, I felt like it was unfair. I was sad. I was losing a piece of me because my brother and I are so close together, and he was gone, and I was like, that pisses me off. What is going? But people were telling me that I was traumatized. Something I was no something was being taken away from me, so I was grieving, and that there was a loss there. But I didn't identify it as that. I didn't identify it as trauma. So I had to learn how to identify trauma, and I've learned to help my staff identify when they're going through trauma, and I've learned to help the clients to identify what trauma is, because like the mentor meter said, it's a lot of those things, overwhelming, and when a traumatic event happens, and when your brain has have an overload, and it's sad and it hurts and all of that. But some of us have learned to cope with it. And even if you ask me today, just if I have to be real with you, most of the trauma I carry is not my own. So I loved it when they said scars on the soul, because a lot of the trauma I carry are my ancestors' trauma, our family trauma, our community trauma. It's not my own. And every time that I feel like, I mean, I could sit there and see a situation, and then I'm going to stop talking. But I teach trauma-informed care because dealing in the hospital when I was the violence prevention specialist, very quickly, I was working with a family who had lost a 21-year-old to a gunshot wound. And then we were at the hospital, and I met that mother. And that mother was sharing with me what was going on. And she was sharing with me that even though she lost one, there was another one that was in the hospital bed that her 10-year-old son wanted to see. So I took that 10-year-old to go see his brother because he was traumatized in that moment that he did not know what was happening with his brother. Fast forward, about 6 months later, I saw the same mother who had then had her daughter shot. And her daughter being shot while her son was still involved in this gang activity. Her daughter was laying on the couch and she got shot, and this same mother was dealing with that pain. And then fast forward again, about a year and a half later, I had to respond to the hospital to a 12-year-old, and that 12-year-old turned out to be her son, which was the 10-year-old that I took to see his brother in the bedside. I'm like, that tore me up. I'm like, I would not be able to keep breathing if all that happened to me. But this mother still had 3 more kids that she had to take care of. So she had to normalize that pain and cope with that pain so that she could keep going. Now, what would I have served her to tell her, oh my God, girl, you should not be able to, I don't know how you lost one kid, you lost another kid, your daughter got shot, she died. How was you doing it? Oh my, so people, we do that all the time and we re-traumatize. Right? So what I like to do is I validate, educate, and motivate. I validate that what you're going through is hard as hell. I educate that most people never have to deal with what you're dealing with. But then I motivate, how can I assist you in still moving forward with whatever coping skills that you have so that that rubber band does not snap, right? So trauma to me, me personally, I'm still working on that. I'm still learning how I can identify my coping mechanisms as trauma, how I can identify the things that I put up with as trauma, and how I can let people help me with that. I can identify my clients' trauma all day, every day, because I feel it. You talk about vicarious trauma. Oh my goodness, I feel it. I feel their pain, but I can't feel my own pain. And I'm learning how to do that.
Thank you so much, Johnnie. And, you brought up, again, just how you're feeling so, the pain of others, right? And the trauma of others. And that kind of leads me a little bit, to really talk about just the work, the stories that you just talked about and just shared with all of us. It lets us know that this work is going to expose us to so many forms of trauma. And I heard you mention vicarious trauma. Someone had put it on the Mentimeter when we were doing that, when we were sharing those experiences of what trauma, means when we hear it. And so vicarious trauma, secondary trauma, they are common ones that we see in this field. And you really just spoke about that. So I think it's important that we actually have a shared definition of what they mean. And Dr. Vega, I'm going to ask you if you can please share with us. I'm going to share my screen and bring up some definitions. And I'd like you to also share with us the definitions of secondary traumatic stress and vicarious trauma, and also just help us understand how they differ. So I'm going to bring up my screen just to have it up here for us. And then I'm going to ask you to please just walk us through that.
Okay. And Johnnie, thank you so much for sharing some of your experiences. As far as secondary traumatic stress, I really like this definition, which is the normal, consequential, and often unavoidable reaction to knowing about a traumatizing event or events experienced by a significant other, especially for those in helping professions. This was a definition by Charles Figley. And I just want to call out again how this is really normal. And like we talked in, Nicky grounded us with that quote about cost per caring. When we do this work, it's really just knowing that we will be impacted. And also knowing, I think, that there's lots of tools and strategies to support us in our healing journey. Vicarious trauma is a little different than secondary traumatic stress, and that's defined as it can disrupt a person's fundamental beliefs about the world and interpersonal relationships due to repeated long-term exposure to traumatic material. And so when I like to think about how to tell these apart, because they both have a common theme of coming from exposure to traumatic material or wanting to help someone who is suffering or a survivor of trauma. Secondary traumatic stress is more of it can be one event, or it could be a series of events or experiences of another person that impacts us. Vicarious trauma is really this like cumulative, long-term change of our own personal worldview due to ongoing exposure to somebody that we care about, traumatic material. So they're a little bit different, but I think vicarious trauma is this more cumulative change in our worldview, and that could look like changing our sense of safety. It could change the way we trust others, our esteem, our intimacy, our ability to build relationships, and how we perceive the world. And then go ahead, Nicky.
I just thinking of the vicarious trauma, I could think of an example that when my children were young and I was working in the field, and all these terrible things are happening to the people that we care about in the community that we love. I found myself being overly restrictive with my kids and afraid to let them go out, live their lives, and and of course they certainly had a level of privilege too. But even within that, I found that I was, wanting to wrap them in cotton wool and keep them extra safe because I was so fearful about what could be going on out in the world for them. And so it really did change the way I was looking at the world. I just wanted to share that as an example.
And I think next we wanted just to highlight some of the signs and symptoms and reactions of secondary traumatic stress. Again, recognizing that these are really common and normal reactions to doing really difficult and challenging work. And I think wanting just to highlight some of these that stand out, I think one of the biggest ones that I wrestle with myself is social withdrawal. When I'm really overwhelmed and stressed, we tend to withdraw socially. But the research and everything we've learned about trauma and secondary trauma is that we need connection, we need people, we need social support to heal. So that one I always kind of flag, because I think it's one of those catch-22. It's something that when we are impacted by secondary trauma, we become more socially isolated at a time that we really need others to support us. And the other one that isn't talked about a lot, and I think from my own personal experience with secondary traumatic stress in the work, I used to always check in with myself, on an emotional level. I used to believe that secondary trauma could only impact my emotions. Like I would be sad or frustrated or angry at the injustice in the work. But through my own experiences, it also impacted my physical health at certain points. And I think that's something that I just want to raise up, that if we don't mitigate this and we don't create spaces and places in our workplaces to address this and be proactive about it, it can lead to some physical illnesses as well, like hypertension and cardiovascular disease and those types of things. But I want to just call out some of these other ones that all of you may have experienced: chronic exhaustion, anger and cynicism, minimizing, hypervigilance, survival coping. Again, there's disconnection that comes up a lot, poor boundaries. This other one that's really interesting is diminished self-care, right? So I think often we're told, like, self-care, you work all these long hours and you got to go home and do more self-care. And that I used to always feel really frustrated, because after, we work very difficult, challenging jobs. And so sometimes you don't have the energy to kind of go exercise or always cook healthy meals and those things. But it is true that, like, until society changes, we'll need to be committed and intentional about both individual self-care strategies and organizational strategies to really have our well-being the best it can be. And then I think also, I think Nicky may have called this out earlier too, but when we think about secondary traumatic stress, I want to make sure that we walk away from this knowing that it's not due to, like, an individual deficit or something that we're doing wrong, or because we have poor boundaries or we're not strong enough. Secondary traumatic stress is really like a systemic issue. There's societal factors and community factors and many organizational factors that really contribute to this. And I think we're going to talk a little bit later in our panel today about some of those organizational things that people are doing to really prioritize the well-being of our frontline and all of our teams to stay healthy while we do this important work.
Thank you, Laura. And even with all of the definitions that you see and the explanations that we're giving, I still have to lift up the fact that culturally and I would say environmentally, these things still might show up differently with your family background and with the resources, because I saw a lot of that come up on the mentor meter. A lot of those elements still can affect how these elements that you're looking at now show up. And how they are portrayed, and not even that, but even how they're viewed by others, the lens that they're looking through. So that's why this is such an important conversation we're having today, so that we can definitely make sure that we are not pigeonholing, people into what kind of trauma they're searching, and what it means to them. Because trauma-informed care, oh my God, it's just such a big thing that we're working on right now. And you got to have so many different lenses. And the first thing I do in my classes when I teach trauma-informed care is you have to understand what trauma is, and you cannot assume that it's the same for everyone.
So thank you, Johnnie. And I just want to add too that it's important that we recognize the challenging times that we're living in right now, and that, yes, secondary traumatic stress happens in relation to our work, but we're being bombarded by so many things that are going on in the world around us also. And depending on our level of privilege and who we are in the world and how we walk through the world, that level of additional secondary traumatic stress is not something that we can say is equitable across the board, right? It's going to be different for different groups too.
Thank you all so much. And especially really, Dr. Vega, thank you also for those definitions to secondary traumatic stress and vicarious trauma. So we can just have a better understanding and also just, what that looks like. Because we know that many who enter this field, they're carrying various forms of trauma, right? And this carries over even from other sources. So this can make it difficult in the work to separate the work from someone's personal life. And so my question, and I really also want to start with you here, Johnnie. My question for you is, how do you approach situations where you recognize that you or your staff are struggling with this? And how difficult is it to identify that this is happening and that you are carrying the stress of others?
It's not difficult at all. And the first thing, just knowing my people and just being able to have conversations and giving space for it to be okay to be genuine, to be for it to be okay for them to bring to the table how they're feeling, and then we can kind of identify. Alma, one of my directors for the hospital program today, in one of our staff meetings, she did an exercise that was talking about squeezing the orange, right? Like you squeeze an orange. If you squeeze an orange so hard, what's going to happen? Orange juice is going to come out, right? And if you didn't want orange juice to come out, you shouldn't have squeezed that orange the way that you did, right? So we had an opportunity to talk about our emotions and how we bring that things to the table. But basically, what they were saying in that is you're going to get out what's inside if you squeeze too hard. Right. So how I try to help my staff identify is like what you're carrying with you is going to come out eventually if it's not addressed. Right. And my staff, I don't even think that they're allowed to have those feelings, because when we talk about that, it's identified as lived experience. That's what we're calling it. It's their lived experience. Right. So I'm like, we have to be able to allow that lived experience to show up in this natural form. So yeah, it was lived experience, but it was traumatic, right? And help them to be able to deal with that, because they have to call it their lived experience to be able to sometimes be employed and to be validated in the work, and for others to listen to them, especially those that are not from our neighborhoods, those are not from where we're from. They want to see that lived experience validates us for being in the work. If we don't have the PDs and the MDs behind our name, and if we've not done all these years of study, that lived experience, we got to suck up the trauma to be able to use that lived experience to work with our loved ones and our young people in our communities, right? So just being able to balance that and be able to understand that, yes, I have lived experience, but it effed me up. I almost cursed you. You got to watch me, because sometimes I slip up. It effed me up, right? And I'm bringing this to the table to say, I want to prevent that from happening to others, but healers have to be healed. And you got to start with that. So that in my organization, that's what we do. We make sure that we look at each other as the whole person, not the skill that you bring to the table. And we see how do we address what's going on around you so that we can strengthen you and make sure that you are going to bring your best self to our community, your best self to the young people that we're serving. And not only that, because I feel responsible for bringing somebody who may be effed up and use their lived experience into this organization to help the community and send them back home even more effed up than they came, then their family is a disservice. So I definitely don't want to do that, right? So just making sure that we recognize that these are our loved ones we're dealing with and see them as their whole self. And don't squeeze the orange, damn it. I'm sorry.
You were close on it, Johnnie.
I
You almost
was.
got it.
Almost made it.
Dr. Vega, I'd love to ask you the same question.
Yeah, I think this question, when I hear it, really makes me think about just how important trauma-informed supervision is, and how, and just to shout out HAVI, they have an excellent training for trauma-informed supervision, but it's not about creating space where you talk about all the administrative or the cases that people have, but it's really being in front of the whole person and asking, your staff, how is this work impacting you personally and professionally? it starts with, when we hire somebody, making sure that they understand what secondary traumatic stress is, asking questions about, what are their coping skills? How do they deal with secondary trauma? It's creating spaces at work where we can name it and be vulnerable and normalize people's experiences so that when they are overwhelmed or they are triggered, that they can come to a place and say, I'm not okay and I need help. I think that's the biggest thing. I think there is so much stigma, and we're still not okay with not being okay, myself included. But trying to really figure out how do we show up as our authentic selves, and how do we make sure as supervisors, as leaders, that we are doing our part to create those spaces and to normalize and to keep empathy with what we're asking people to do each day in bearing witness to other people's pain and injustice and the violence that's happening across our country.
Thank you both so much. And, when you talk about, again, protecting your staff and protecting you as well, and supporting you, in this work because of the trauma that comes with it, we know that even as people come into this work, they come as survivors themselves, or just having the passion to do the work to support their community, right? So, however, as we've just talked about and went through quite a bit, we know that doing this work can be triggering or can activate many things for many people. And so, Shamika, I want to really ask you this question. What are some signs that you have seen in yourself or others that indicate that mental health and or emotional challenges related to this work? And how do you cope with those triggers or those activations with yourself?
Thank you, Marquita. That's a good question. And I think I saw someone in the chat asking that also. I feel like in this work, many of us develop like kind of a heightened awareness. You know what I mean? What we would call hypervigilance, but we're not even really aware of it. That as people, our behaviors are shifting based on our trauma, past trauma, things we've seen, heard, or been through, directly or indirectly. And over time, that same heightened awareness starts to present itself at home and in everyday life, making it kind of hard to just relax or trust or even feel at ease or safe when we're supposed to. For me, working in the emergency room and dealing with homicides, I realized I was constantly on alert. Even in safe spaces like home, I would always think the worst scenario, like all the time. It drove my kids crazy. Just, from little things of, working in the emergency room in the inner community, seeing a lot of young men like my son, I think Nicky touched upon it. I wanted him to live his life, but I was definitely starting to become like a helicopter mom. Where you going? Who you with? Where is this? I need an address. I need, you know what I mean? Just because I started to not really trust anyone or trust situations or, and it's also the company you keep. It's not that I didn't trust my son, but it's like, I don't trust people. So I just started to always kind of find myself living in fear. Even if they're driving a car, make sure you put your seatbelt on. I used to, my daughter used to always put her feet on the dash. And just from seeing an accident where somebody had their foot on the dash and like had a bone like come through their leg, I was like, oh no, you can't do that anymore. Like, and she's like, Mom, like everything is not going to happen to everything you see isn't going to happen to us. But you really start to live that way. So it also affected my sleep. And I always thought of myself as a light sleeper. And I read something that said, light sleepers actually don't really exist. It only means that your nervous system is always on. You're always in fight or flight. Your nervous system never fully relaxes. So, and like more examples of that, like jumping at sudden noises, scanning rooms automatically, when you go into public events, looking for exits, sitting with your back against the wall. I'm guilty of all of those things, not realizing like that's just like a secondary kind of trauma that lives inside of me. And now it's just becoming like an automatic thing where I'm always living in like a fight or flight kind of system, my nervous system. So for me, I feel like I try to cope with it. I don't want to live in constant paranoia because that's what you're kind of doing. You're just always paranoid of everything. So I try to just think and speak positive thoughts. I'm spiritual, so I try to just pray and let it go. I also tell my friends and family, like if they see me kind of being a little paranoid or just, let me know and kind of just keep me grounded. And I try, like before I go to sleep at night, I try not to watch anything triggering, like those like crime shows and things of that nature. Like I try not to. I don't watch the news. Like, I want to watch things that are like, comedy or just really lighthearted. Not something I have to like think about, just so I can try to relax or, listen to soft music before I go to bed. Nothing real like, hype, journaling, or just anything that's relaxing so that, I can just kind of relax my body, sleep well. I try to, as far as my kids go, I think that part may never go away, but just trying to let them live and, realize like if something's going to happen, something's going to happen. You know what I mean? And just, I can't just live in fear and, so yeah, but I feel like, and a lot of us just recognizing that in yourself and other people, and realizing that that is a trauma response.
Wow, man, Shamika, you just took me back because that was me to a T, right? Because I did lose a twin. I had twins and I lost one, and I was exactly like that with my surviving twin, who's doing great now. But my question around that is like, how do you stop doing it when it makes sense, right? It makes sense to be protective of your children. It makes sense to follow them and track their. It makes sense to like put your foot down because it's something it makes sense. So how do you stop it when it makes sense, right? So I'm still struggling with that piece of it. Like I'm a very protective father. That's what I'm supposed to be. That's what, as a male, that's what I'm supposed to do. And then back to the cultural and the experience. Like I'm from Chicago. You had to do that to live, right? So it's like how do you stop those behaviors when they make sense? And I think that's the biggest thing that I deal with my staff. And some of the things I recognize, I can see the signs in their handwriting. If they're signing a check, if their handwriting is off, something's going on. I can see the signs in how they're dressing when they show up. Like if I'm used to them dressing a certain way and they're dressing different, I can see the signs in that. I can see the signs how they respond to me, right? Or what they even call me. Like sometimes they call me boss, like, hey boss, what's going on? Or hey chief, or if they change up what they call me, I can see the signs in that. I can see the signs in when they're talking to, because sometimes I'm monitoring them talk with their youth and they're checking in with their cases. And I can hear the words, and if the words are different, I can see the signs in that when they come to work, how they interact with each other. Sometimes they're joking with each other, and then that next day that same joke wasn't that damn funny, right? I can see the signs in that. So just being able to keep my eye and be, like Shamika said, hyper vigilant of like, what is the environment? Because any moment it could be a kettle pig, like it can go at any moment. But just being able to be in those moments to let people know, because they don't recognize it in the moment. Shamika, they don't know that that's what's going on with them. They have not yet learned, like myself, how to identify their trauma. They don't know how to, even when they know that it's trauma, how to cope with it, how to stop it when it makes sense. They haven't gotten that piece of it yet, and nor have I, to the fullest, but I can understand it and recognize it. So in those moments, you got to pull that coattail and be like, you good? Right? And sometimes when you don't have the answer, yes, I'm good, we have to be able to accept I'm good enough.
Mm-hmm.
I'm good enough in this moment so that we can have this conversation and move forward.
Yeah, that's so true, Johnnie. And I think, everything that you both have shared is so powerful. And I resonate with so many of the experiences that you're talking about in different ways. But working with homicide and also losing clients sometimes, right? You may have put a lot of energy, you may have worked with someone for a long time and built a wonderful relationship with them, and they're really trying to make a change, and the environment just doesn't let them do that. And, and we lose them. And I can say that I may have been in this work for 35 years and I may have developed a lot of coping tools that help me, but there are still days when, you know, the substance hits the fan and everything goes out the window and I can't get my balance and I can't get centered. And so I've always, you know, that's when your buddies come in, like, especially even if you're in a supervisory role, frontline or supervisory role or anything like that, you need to have those people at work that you can depend on as well. And if you can't have them at work, you find them. But because you don't want to be taking this home and bleeding all over your family, you want to be able to address it as much as you can, you know, in the work, whether that be, you know, with a professional or, you know, for me, I'm going to shout out right here. I'm going to shout out Kendra Simmons and John Torres because they were at Youth Alive, because there were days where I would come into the office and I would be saying, like, I know I can't take these kids home. I know I can't do this, but I want to. Like, every fiber of my being was about wanting to protect. And, you know, my eyeballs might be sweating. Lots of things could be happening, but I could go to them and they could understand and help talk me down or help reality check me and help me get, you know, get myself back on a more even keel, because we can't do this work in isolation. Our community is so important. And so I wish all of you that kind of support system.
Nikki, wow, that's so important. And you reminded me, like, sometimes I have to like look in the mirror in the morning and see who I'm taking to work with me and what are we carrying in our backpack. You know, that helps me like to understand, like, if I know that, no, this isn't Johnny going to work, this is Pedro. Pedro's my alter ego for those who don't know. If Pedro's getting ready to go into the office, we should probably not go right now because it's not going to end well, right? We know. And then what is Pedro carrying in the backpack? Like, you know, you got pissed off last night or something happened. Now, what am I taking to work with me? Because how does that benefit the work? Because if I'm taking the wrong person to work with a backpack full of stuff that's not going to benefit the work, then I need to revamp before I even get there, right? So thank you for acknowledging that and helping me remember. Like every morning, I got to do a check. Like, what's going on with me.
Thank you all. And I didn't know, Dr. Vega, if you had anything you wanted to add to that as well. But thank you all so much for those reflections.
Yeah, no, just want to thank Shamika for sharing her experience. And I think you guys covered so many important points.
And so, Johnnie, you really spoke a lot about your staff and being able to recognize that you know your staff so well, being able to recognize even some behaviors that they may, nonverbal and verbal behaviors that you can notice when something may be off. And so my next question, is what are some examples? Because if we know that we're seeing this even in our space when they're coming to work, what are some examples where you have seen challenges to even engage in mental health and wellness? How do you overcome these challenges? And again, Johnnie, if you can, walk us through some of those things.
I would say, starting out, some of the most overwhelming challenges to overcome is the acceptance of I'm going through something. How are other people going to perceive that, right? I don't know if you guys ever heard of the kick the dog effect that we often have. We can go home, we show our best selves to the out facing public, then we go home and kick our dog, and because the dog is always be there, and sometimes that moves into our family, and that's where domestic violence grows out of, and sometimes that moves into other things. But I think that one of the biggest barriers that I face is especially dealing with men who have lived experience. They're trying to sometimes make recommends for all of the things that they've done in the past, and they'll tell me that straight out. I caused so much damage in the past that now I want to give back to the community. I want to be able to prevent young people from going through what I'm. That's what I hear a lot. And sometimes doing that, you cannot miss a step, especially if you've made a lot of mistakes before. You can't miss a step. So the biggest barrier is for them to be vulnerable and let me see what they're really dealing with. Because you don't do 25 years in prison and get out and be good. there's some, oh, I almost said it again. There's some stuff you bring along with that. Your backpack is full of stuff that we might have to start unpacking, right? So the vulnerability was the biggest thing. And then not only just being vulnerable with me as their director or their leader, or even as their coworker and friend, but being vulnerable to others in the industry, other agencies or other coworkers. Just the stigma behind mental health. You can't call it mental health because the stigma behind that, sometimes is even there. I had an employee that worked for me, and he acknowledged what he was dealing with me and in our meetings, but he did not want me to say it to anyone, and he never wanted to go to get any help. Let me tell you why. Because federally, I'm not sure if everyone knows this, but federally, it states that if you have ever been committed to a mental health facility, you cannot bear arms. And he wanted to be a police officer, which meant that he had to be able to bear arms, and he was afraid that that was going to stop him from being a police officer because of that federal mandate that if you've ever been into a mental health facility, you can't bear arms. So he suffered for many years around that until I was able to, again, validate, educate, and motivate him. I had to validate, I get what you're saying, and educate him that police are human too, and they go through situations, and they have therapists as well, right? So it's like, that he took that and he misunderstood what it actually meant, and he let that lead him for at least 7 years of his life to not get help, mental health support or emotional support, because he didn't want it to jeopardize something else. And many of us, we identify that in like so many other ways. It's like the barriers becoming, so first it was the barriers of not being able to pay for it. So we write a grant and we'll be able to pay for it. But then it is the barrier of who do they go to and who they speak to. So our staff, we've been able to bring on the therapists of color, and that's been able to help us out. But then the barriers of like, how do I look with my family? Some families, we talked about earlier, when does the trauma look like resilience? Some families have become so resilient to their situation and to their circumstances that they don't allow space for even anyone in their family to reach out and show vulnerability in that way, right? Boys don't cry, men don't do this, and if you're going to be a real woman, just those kind of stigmatic phrases that keep us boxed in. Those are the barriers that we find it hard to overcome. And then I think that even after we overcome all of that, another barrier is each one teach one, each one reach one. So when I got it, I should have been able to use my equity to go to the next one and say, hey, this is all right. This is all right. We can do this, right? But sometimes even when we find our medicine, we don't want to share the medicine. and that's so damaging to our community. Once we got the medicine, we should share the medicine and not sell the medicine. So those are some of the barriers that we've had to overcome, not only just in our agency, but in our community and in my family and in our culture.
Yeah, thank you, Johnnie. I think you talk about the stigma, and I think it's really powerful. And I think when we think about barriers to getting help, I definitely think that I feel strongly that if the exposure to traumatic stress is coming in our workplaces, the solution and the support needs to be embedded within the workplace. So I love the example, Johnnie, that you brought a therapist into your workspace. And I also think a lot of times that the type of violence prevention work that we're all doing, it's a chronic, right? Unfortunately, violence is happening at high levels across the country. And so I also think it's important to be proactive, not just bringing in resources after tragedies, but building up teams and building up capacity so that when things are really hard and difficult and everybody's kind of, at a 10, you have the community already built within your teams to be resilient and overcome those challenges. So I do think the biggest factor that is a barrier is that a lot of us doing this work got into this work maybe because we were really good at helping or mediating, or people came to us a lot of times, whether it's in the community, to help resolve conflicts or to address things or to support them. And I do think there's still, it's hard for a lot of us in this work to ask for help. And so I do think that that just runs really deep. And I think when we embed things in our workspaces, it gets easier to be vulnerable and to address the root of where the stress is coming from.
And I do just want to lift up right quick. You know, when we did the registration, we had a lot of, you know, there were a lot of things that came in on what you all were saying also was something big you were seeing. And so we definitely want to highlight that. So a lot of that was lack of time was a barrier, lack of personal finances was a barrier, organizational culture, feeling like you are on all the time, understaffing, excessive workloads, lack of resources, and threats to funding for programming. So even in addition to what you all were just saying, those are a lot of things that even out, you know, those who are, you know, watching this webinar right now and they registered, you know, our field was saying these are some of the things that have been big barriers and challenges for them as well. And so I really want to ask that because especially when we see those barriers, we see these challenges, we understand that not everyone even has access to mental health support. And many times funding and money get in the way. So I want to ask you, and I'd love to hear again from all of you, what are some of the creative ways you have come up with to overcome those challenges and help you and your staff and your organization?
I can start. I've worked at an organization where self-care was a priority, and if the organization has funding, they used to give a stipend. It was like $300 a year towards anything self-care, and they wouldn't just give you the money. Like you can come to them and say, hey, I want to go to a spa, and this is how much it's going to cost, and they'll like write a check directly to the spa of the cost. And so anything like that, as long as it had to do with self-care, because I felt like if they gave you the money, then, you know, you'd probably pay a bill or, you know, something that was necessary, but it wasn't really doing something for yourself. But I realized, like, you know, especially like Marquita just mentioned, in this day and age, funding has become really, you know, scarce these days. So they also gave what they call flex days. Like they gave us 2 days off a month without using our benefit time or anything. It was a paid day off just as a break. We made sure that if we had therapists for our clients, but they also made sure that they were there for us also if we needed it. I feel like debriefing or just peer support, our team without management would also meet with each other and just say, you know, hey, this is a check-in. Like, what do you need? What are you going through? Are you overwhelmed? Like, what's your caseload? Like, how can we help? So I just feel like being really supportive and just really being open to knowing like this work is hard. And like you said, you have to know your staff, and you can't burn out your staff because you're not going to have, you know, you can't burn out the helper or the healer, because then who's going to, you know, be there to heal them. So just making sure that, you know, in creative ways that you do something to de-escalate or to regulate your staff's nervous system, whatever that may look like. And, you know, let them put in feedback as to like what they think that would work for them, because only they would know what worked for them. But I do feel like just debriefing helps a lot. Days off help a lot. And just being open to communication, saying, hey, I'm a little overwhelmed, and just being understanding of that. And, you know, so.
Thanks, Shamika. I think on our team at CHOP, we were able, this was such a big issue, secondary traumatic stress for our staff. We developed this stress loss initiative, which is a trauma-informed group model. And we meet 90 minutes once a month, and it's facilitated by someone internally on our team that's trusted. And it's really been amazing to just create a cohesive culture where we care about each other and we're there for one another. I think another thing that it does is that a lot of this panel today, we talked about the costs of caring, but there's this whole other side to our work that should be like the rewards of caring, right? Like we bear witness to so much transformation and strength and healing and resilience. And so it also is a space where we can lift up all the great things that happen. That sometimes they don't sound great because you have to do the work, and like there's many nuances. So somebody who doesn't do this work, it may not sound great, but also celebrating the wins as a team and the ways that we see transformation. So that's one thing I would say, that we've been fortunate to have the Stress Less initiative there. But also, secondly, I want to say that we talked about many of the things being organizational in nature. So things being like trauma-informed supervision being so important to this. Things like balancing and managing caseloads, making sure that we're paying attention, that the caseloads aren't so high that we're not being intentional about the well-being of our staff. And sometimes that's a delicate balance between being there for our clients and being there for our staff. And it's a dance that I do all the time. And it's hard to, where do you draw that line at times? But I think those things are really important. Paid time off, our salaries, all those things matter and contribute to secondary traumatic stress as well. So I think those are the things I would look at, kind of like, what are those organizational factors that also can help decrease risk for STS?
Thank you, Laura. Just so many powerful things are being shared. And I just want to mention at a moment, because we all know we could talk about this all day and we don't have all day, but we will be sending and sharing with you a handout that was generated that shows a bunch of the different types of tips and tools organizations have been using. So you will get that in addition to the conversation that we're having today. I definitely wanted to make sure to raise that up and really recognize, that you can't be a trauma-informed organization if you are not supporting your staff, if you're not taking care of them. You're just paying lip service to a name. You're not doing the deed. You're not doing what you need to do to take care of yourselves and the people that work in your organization. And we have to remember to be kind to ourselves, and a big part of that is also making sure that we're looking at equity in our organization and making sure that everybody has a voice that comes to the table. And we wish, like Laura said, I wish we could pay everybody, so much more than they are paid for the incredible work they do, and continue to do every day. And also remembering, if you're lucky enough to have an employee assistance program, make sure you folks know about what resources that are available to them through their health plan or anything else, right? Make sure they know what they can access. At Youth Alive, we also have a couple of identified therapists who staff can contact during difficult times, or have offered circles when something major is going on at the organization or in the community. We also, have an equity sort of committee and group that met from all people from different levels in the organization to also talk about what do we do to help deal with harm that we could be causing within our organization. It's not always all coming externally. And how do we help people mitigate and manage that? And how do we help people heal from harm? And there's going to be so many other resources also, that you'll get these different things, because, time is of the essence right now. But, making sure we even have there's a work staff meeting one month, and there's a fun staff meeting where we just get to hang out and do fun things together. What can you do that doesn't cost? And for mental health support, I just wanted to share one other thing, and that is, yes, we had mental health support through our health plan, but they had no clue about how to handle the kind of things that our folks deal with at work. So what we did was we reached out to local mental health chapters and organizations, spoke to people who provide that kind of trauma support, asked them if they would be willing to give low cost or no cost services to the people who are doing the kind of work we do. And we came up with 30 different providers who are willing to donate time to our staff. So sometimes it just takes so much creativity on our own parts too, right? To really meet the people, to meet the needs of our beloved community. I'll stop there.
And I won't spend much time because the ladies have done a wonderful job in saying all the things that we as agencies should and could and are doing. But before we got the money, we were doing healing circles. That doesn't cost, so we can do healing circles. And also, if you've part of HAVI, then you know about the brave space. You can create a brave space within your agency. But let me even go all the way back to the roots. Before I got into any of this, I would go sit with my grandmother. God bless her soul, and she would heal me better than any therapist ever could, right? So find a trusted person that you can talk to, right? I mean, like my daughter is the person now that my grandmother's gone. Because I just need a sounding board. I don't need you to fix me, right? You can't. Therapists are not going to fix you. They're just going to, be a sounding board and listen to you, and that's what your coworkers can do, your family can do. That doesn't cost you anything, right? So find a trusted person that you can talk to until all these other things can be put into effect. And sometimes you need it with that, right? You need the therapist, and you still need someone that you can just get real gritty with sometimes, and just like be real, like butt naked, like this is the truth about me. Let's just deal with it, right? So just thank you all, ladies, for all the wonderful comments.
Thank you all. Just that is, and like Nikki said, everyone, we are definitely going to send out resources because we want you, as I said, to have those tangible resources. And the panel and the whole faculty team has put together a list of things from all over that they have been doing and incorporating that can be able to give you some just ideas of ways to support you, support your team, support your organization. We do have just a couple of minutes, and if there is a question, right, that someone has right now, we'd love to, if you want to drop it in the chat and we can answer that, because we just have a couple of minutes, that if someone has something that was just so passionate and just you feel it's on you to ask the panel while they're here, please, if there's anything, go ahead and put it into the chat and they will definitely answer that for you. Trying to see if anybody has anything. All right, I don't really see a question coming through, but I am, as maybe a question is coming up. Shamika, I'm gonna let you kind of close us out on just understanding the growth, the post-traumatic growth, okay? And so if you don't mind, just bringing us to that common foundation of what that growth looks like through that trauma.
Okay, I will first, thank you, Marquita. I will first read Post-Traumatic Growth is a process whereby we transform our struggle into new path and an outcome where we experience positive changes because of the struggle and the aftermath of trauma. That's basically saying like you're turning pain into purpose. You don't let your pain and your trauma just fester, like you do something about it, whatever that looks like to you. Be it some people have fundraisers. Some people have like community events, or, I know that some of my past clients, if they lost their son and their son was really into basketball, they would throw like basketball tournaments yearly on his behalf in his name. So really just turning your pain into a passion and purpose. And, if you've lost a loved one, making sure, that person didn't die in vain, that you're keeping them alive and you're keeping their spirit alive. And so really just, I feel like just growing in your pain and not living in it. That's really important because that will eat you alive, like inside and out. We all know stress kills. So although it's hard, of course you have to give yourself the time and space to heal and to deal. But once you've gotten to that space, then talk to people, or just talk to like-minded people who maybe aren't where you are in their healing journey, and you can help them get to it. So really just growing in and not living in your pain and trauma.
Thank you so much, Shamika. And the reality is everybody who's here, who's trying to show up and help others heal, is already working on their post-traumatic growth. So keep at it, folks. You are special human beings.
I definitely want to echo on that. You all, thank you so, so much. This has been just amazing to sit and have this conversation with you. As we said, this is the first one of many, so I hope that you will continue to be a part of this series. But we thank you all for joining us today. We hope that you are leaving with not only reinforcement of what you're doing well, but also some new tangible resources. I hope and that you were able to, again, just really glean on a lot of the things there and just reinforce those things that you are doing. Again, this session is being recorded, so you'll have that plus the resources that we have for you. They will be available, and they'll be available on the website. And so just give us a couple of days to get that up. And then just most importantly, you all know we love you so, so much. We truly honor you, what you do in this field, what you continue to do in this work. And we just want to thank you for that. And as we close off, panelists, do you have any closing words, that you wanted to say?
I'll start. I just want to say that you guys are wonderful in the work that you do, and I appreciate it. And you're great. But don't believe the hype. Don't let the hype get you, block your blessings. People will say you're so strong, and it is so great how you always take care of things, and it is so wonderful how you never need to. No, that's cool when you're able to, but it's okay. It's okay when you're not so strong. It's okay when you do need to reach out for help. Don't let those words blow your head up, because then nobody. What happens when you blow a balloon up too big? It pops.
I just want to say a lot of, I think the audience is in violence prevention work, and just want to lift up all the people, especially the frontline specialists, that just give so much of yourselves each day, and so much love and compassion and sacrifice to show up for others. And just want to thank you for all that you do.
I think what Johnnie said again is just so important, is that you can't help other people. You can't fill someone else's cup if yours is empty. You have to be practicing good self-care. Even if it's hard to do it for yourself, just remember you'll be the best provider you can be if you're practicing good self-care, if you're taking care of yourself, if you're in an organization that is holding and supporting you. And it's been an absolute honor to spend time with you and these incredible panelists today. And I just wish you all safety, good health, and love and healing.
All right. So again, everyone, we thank you so much. Thank you for the work you continue to do. And I say it all the time in VPP trainings and all, we love you so, so much. And we want you to take care of yourself. And so thank you for just your engagement and all. I do see that we had a question come in the chat, but we'll try to answer that and possibly give some support in around that, in like an email or whatnot, so that we don't go past this time, since we are right at time. But don't worry, we will support you with, an answer to that question. But again, everyone, thank you so much for your time with us today. Thank you so much for your engagement with us today. And we hope you take care and continue to support yourself and each other. Bye, everyone.